My name's Philippa Shreve. I'm the Director of Clinical Services here at Treetops Hospice Care. So we've been really fortunate that we've been able to start to introduce the use of personal health budgets for people who are in the life-limiting phase of illness. And that's been a real good opportunity because it's enabled us to think differently about how we can support people with their care needs and to give them an opportunity to think about what they might actually need in the way of support and how that might be different to what we've always traditionally done.
We are very much about empowering people to know what their choices are around their care and to make that very personalised, and it is very different for everybody. One of the people that we're helping with a personal health budget is Carolyn, who has a long-term respiratory condition, and she's had that for many, many years, and she's lived with it and is doing very well. But just recently her infections have become more frequent, and she's recognised that actually this is the terminal phase of her condition.
I first found out about the personal budget through my clinical nurse, Alison. We were talking sort of about what my needs were and how an electric wheelchair would help me. And then Alison came up with the personal budget side of it, which I'd never known. And to be honest, in my wildest dreams, I never thought I'd get it. In my wildest dreams. Alison made it so easy. She helped me through it. She helped me through the forms. She taught me through it. So yeah, through Alison, it was made a lot easier. The impact on having an electric wheelchair will be enormous. I'll be able to nip over to the shop and get me pints of milk instead of sitting at home. Silly things in everyday normal life. It's silly things. But those silly things, when you're like me, are major things.
I think people's fears often are that they're going to be given money to then have to think about how they plan and use it. But actually our whole approach has been to do the support planning, the thinking, the conversations much earlier before you then finally get to the point of saying, right, and this is then how we're going to use this particular envelope of money. For us, personal health budgets is all about personalisation. It's allowing the opportunity to have conversations with people earlier on in their care needs that actually talk about what is important for them and what are their aspirations for their life that they still have, the way in which they want to spend it, and the care that they need in order to support them and enable them to do that. And personal health budgets allows us to do that and to deliver that in a very personalised and support plan way.